Hi, my name is Dr. Courtney Weems, and I am a pediatrician at Chicago Concierge Pediatrics. I am a board-certified pediatrician and a member of the American Academy of Pediatrics. I'm here today to just answer some of your questions about COVID-19 as they relate to your children. So the first question I received was, how do we know when to reach out to get advice from medical personnel about our child? When should we talk to our pediatrician? So number one would be a fever. So a fever in child is 100.4 or above. If your child has a fever for more than 3 days, you should reach out to your pediatrician to discuss the symptoms. If your child has a cough, cold, runny nose, likely that's from a virus, and that's okay. And that's totally manageable, and you can likely handle everything at home. But if your child starts to develop respiratory distress, you need to speak with a pediatrician immediately. So respiratory distress means that your child is breathing faster, breathing heavier, having trouble breathing. Maybe completing sentences is difficult. Eating could be difficult because they can't hold a bottle in their mouth, or they can't drink, they can't eat because they can't breathe. Other signs would be using muscles in your neck, muscles in your chest or your belly, or your nose is flaring in and out. That would be a sign of respiratory distress in your child. You would need to immediately speak with someone. Another sign would be a baby that isn't eating any longer. So is eating fine and then all of a sudden stops eating. That's because it's difficult to eat when you're sick. You have a lot of extra mucus, and then you also have the extra problems with breathing. So that's another good indicator that your child is sick. So that would be a reason to call your pediatrician as well. Calling your pediatrician is the best way to do things from the beginning. And through telemedicine, they can see whether you need to be seen in the office. And that just reduces your risk of any exposure to something like COVID-19. All right, thanks guys.